All right, that was a nice break. Took the dog for a walk, and we're back. So we are on page 43, and we're in drug supply chain integrity. The FDA regulates pharmaceutical quality through the use of current good manufacturing practices, CGMPs. These are standards that manufacturers, repackagers, and pharmacies must comply with to ensure identity, strength, quality, and purity of products. Current good manufacturing practices, CGMPs, require manufacturers to obtain raw materials meeting certain quality standards, establish high quality operating procedures, and maintain reliable testing laboratories. Any drug produced in a manufacturing facility that does not meet current good manufacturing practices is considered adulterated by law and should not be purchased by a pharmacy or distributed to patients. There is an increasing prevalence of counterfeit, misbranded, adulterated, and diverted prescription drugs in the United States. To prevent these drugs from entering the legitimate drug supply, the Drug Supply Chain Security Act, the DSCSA, was passed back in 2013. The Drug Supply Chain Security Act, the DSCSA, outlines steps to build a system to track and trace drugs as they are distributed within the United States. Manufacturers and repackagers are required to include a product identifier on drug packages, which must include the NDC, serial number, lot number, and expiration date on each package. This requirement applies to prescription drugs that are intended for human use. Many products are exempt, including over-the-counter drugs, veterinary drugs, active pharmaceutical ingredients, blood products for transfusion, radioactive drugs, drugs used in imaging studies, certain intravenous products, certain medical gases like oxygen, homeopathic drugs and compounded preparations. Manufacturers, wholesalers, distributors, pharmacies, and repackagers, collectively referred to as trading partners, are required to provide the subsequent purchaser with product tracing information when engaging in transactions involving certain prescription drugs. Anytime the drug is moved from one place to another, records for the drug have to follow. There are three types of records that must accompany all drug transfers. So we have the transaction information, TI, the transaction history, TH, and the transaction statement, or TS. So TI, TH, and TS. So the transaction information, history, and statements. They can be kept in paper or electronic form. They must be maintained for at least 6 years from the date of the transaction. Again, that is the federal requirement, 6 years from date of transaction. There are some situations that are exempt from this requirement, which includes dispensing drugs to patients, providing drugs to a practitioner for office use, and distributing drug samples. We're on page 44. Drug storage in the pharmacy. A pharmacy should be large enough to provide adequate storage of the drugs that it dispenses. The pharmacy department must have a clean and secure space with proper lighting and ventilation. Humidity and temperature in the storage and dispensing areas needs to be maintained according to manufacturer requirements to ensure drug stability. If it is not specified by the manufacturer, the medication should be stored at controlled room temperature. This is defined by the USP and the National Formulary as between 68 and 77 degrees Fahrenheit. For drugs requiring refrigeration or freezing, pharmacy must have the proper equipment to both maintain and measure the temperature. Refrigerator and freezer temperatures need to be documented at least once a day in the logbook. Any drug that is not kept under proper conditions is considered adulterated and must be removed from normal drug stock and placed in a separate quarantined area for storage and disposal. Counterfeit, recalled, and expired drugs also need to be quarantined. Quarantined drugs must be labeled appropriately to avoid accidentally dispensing them. Alright, so we have controlled substance storage, investigational new drug storage, and expired or outdated drugs, as well as drug samples. Controlled substance storage. So the DEA requires Schedule 2, 3, 4, and 5 drugs to be stored in one of two ways. So they can be stored either in a securely locked cabinet, vault, cage, or building with perimeter security which cannot be easily broken into. This can include storage with Schedule 2 drugs, provided that it meets the Schedule 2 drug storage requirements, or controlled substances can be stored in a partially concealed manner by dispersing them throughout the stock of the non-controlled drugs. So for example, alprazolam could be placed on the shelf in alphabetical order with the other drugs beginning with the letter A. Investigational new drug storage. Investigational drugs must be stored in a location that has limited access and in accordance with any specific instructions from the supplier. This means that the drugs must be quarantined and separated from the other drug stock. Documentation needs to be maintained for each transport, handling, and receipt of any study drugs. Any breach in practice needs to be reported to the investigator. Alright, now expired and outdated drugs. So expiration dates are estimated in a conservative manner using FDA mandated stability testing. The manufacturer will not make recommendations regarding product use beyond the expiration date based on legal and liability concerns. So the Food, Drug, and Cosmetic Act, again, of 1938 prohibits the sale of any expired prescription and non-prescription medications. Therefore, as we know, pharmacies should not dispense any drugs after the manufacturer's stamped expiration date on the bottle or the packaging or other assigned beyond use dates. Expiration date requirements extend to drug samples and to drugs that are donated to charities or nonprofit medical clinics. It is not acceptable to dispense or issue any expired drugs, even if they are provided at no cost. If drugs are provided to charitable and nonprofit organizations, the charity or the nonprofit must agree to dispose of or return any drugs that expire while they are in their possession. Expired drugs must be quarantined from the rest of the drug stock in labeled containers prior to returning them or disposing of them. We're on page 45 under drug samples. The Prescription Drug Marketing Act, or PDMA, it regulates manufacturer activities to prevent drug diversion, adulteration, and misbranding, including restrictions on distributing drug samples. So again, this is the Prescription Drug Marketing Act, which regulates manufacturers' activities to prevent drug diversion, adulteration, misbranding, including restrictions on distributing the drug samples. Drug samples can only be distributed to prescribers, to the hospital pharmacies, or other healthcare entities at the written request of a prescriber. A healthcare entity is defined to specifically exclude retail pharmacies. Retail pharmacies are not permitted to stock or dispense drug samples. The manufacturer must label any sample drugs with a lot or a control number and a statement indicating that the product is a drug sample. Written requests for drug samples must be maintained by the manufacturer or distributor for at least 3 years. Drug samples must be stored separately from other drug inventory. Many states require the prescriber's office to maintain receipts of samples that are received. Drug samples are different from starter packs and from drugs that are provided free of charge or at a reduced price pursuant to a patient assistance program. We're in the middle of page 45 under drug recalls. This is a good review. We have a chart in the middle of page 45 on the drug recall classifications. So drug recalls are classified based on their level of severity. They could be class 1, class 2, or class 3. Class 1 recall classification. So there would be a reasonable probability that use or exposure to the medication would cause serious health consequences, serious adverse health consequences, or death. Example, there were 2 lots of transdermal fentanyl 12 microgram patches that were recalled because some of the packages contained like 50 micrograms of fentanyl instead of 12. So that could have caused an overdose. So class 2, use of or exposure to the drug can cause temporary or reversible adverse health consequences, or the probability of harm is remote. All right, so class 1 classification versus class 2. So class 2 again is by using or being exposed to the medication, it could cause temporary or reversible adverse health consequences, or the probability of harm is remote. Here's an example. There were several lots of metformin, extended release, and ranitidine and losartan that were recalled because they contained unacceptable levels of a probable carcinogen called NDMA. That is N-nitrosoda-methylamine. Then we have a class 3 recall classification. Use of or exposure to the medication is not likely to cause adverse health consequences. So example would be 1 lot of paliperidone, extended release 3 milligram tablets. It was recalled due to the fact that it failed dissolution tests. Pharmacies must be positioned to receive notification of the drug recalls. Federal, state, or local law enforcement can request that a recall is carried out, but ultimately the recalls are issued by either the FDA or the drug manufacturer. If the recall involves a specific batch or specific batches or lot numbers, the pharmacist will have to check the stock on the shelf and then remove the recalled drugs that are included in the batch or lot number. If there are multiple areas where a drug is stored within a pharmacy or a facility, it is imperative that the drug is removed from all storage areas, including patient care areas and the automated dispensing systems or automated dispensing cabinets. The manufacturer of the recalled drug is responsible to notify customers its distributors as well as patients. Companies can inform the public via press release, phone call, and mail. If notification is sent by mail, the envelope needs to be marked with the words drug recall, preferably in bold red type, and the word urgent should also appear on the letter and the envelope for Class 1 and Class 2 recalls. The manufacturer should provide a method for reporting back to them, as well as instructions on how to handle the recalled product. Moving on to page 46. So if a Class 1 recall occurs, pharmacist has to identify any patients who have received the recalled drug. Then they are responsible for notifying the patient's prescriber and keep a record of the notifications. Some states also require pharmacists to notify the patient directly, either by phone or mail. If a patient returns a recalled drug to the pharmacy, then you quarantine it prior to being returned to the supplier or being destroyed. The pharmacy must include a method for managing drug recalls in its policies and procedures manual. The procedure must include written documentation on the disposition of the recalled drugs, federal law requires that these documents are kept for at least 2 years, though some states may require keeping them for a longer period. It is imperative that a pharmacy responds appropriately to a drug recall and maintains adequate documentation of its response. A manufacturer may be requested to provide the name of any customer, including a pharmacy, that does not respond to the recall notice. Failure to respond could result in disciplinary action against the pharmacy. All right, we're on page 46 under the heading of drug delivery. Drug delivery through the mail or by a pharmacy employee. Some patients prefer to have their medications delivered directly to their homes rather than picking them up at the pharmacy. Delivery options include mail order pharmacy or local pharmacy with a delivery service. Mail order pharmacies must have a valid state license, and some states require them to provide a toll-free number and their hours so that the patient might be able to call them, or the patient's agent to see if they have any questions or if they're having or experiencing any drug-related issues or questions. So again, it is okay to get your medications through like Optum or Humana through the mail order, or you could get your drugs through like Walmart. They have like a local delivery system. I think Walgreens and CVS do as well, but they might be a little bit expensive, more expensive than the wholesaler prices. I think Costco and Sam's Club probably have it as well, so that they would be able to deliver for less than CVS and Walgreens. So again, the mail order pharmacies, they must have a valid state license, and some states require them to provide that toll-free phone number and their hours for the patient or their agent to use that phone number if they wish to receive counseling or if they have any drug-related questions. When mailing these medications to the patient, the outside packaging should not have any identifying marks that indicate the contents. The inner labeling must include information, the information required under federal and state laws. The restrictions for safe packaging imposed by the Poison Prevention Packaging Act apply to the containers inside the package. So remember, child-resistant packaging. Policies and procedures, P&Ps, should be established to ensure that the patient receives their medicine and that it has not become adulterated during transit. This could include ways to track the package, delivery verification, temperature-controlled packaging, ensuring carriers perform security screening of employees. If the medication cannot be delivered, so if the medication cannot be delivered, the prescription may need to be transferred to an alternate pharmacy for pickup. We're on page 47. An alternative to mailing or shipping prescriptions is delivering the medications directly to patients by a pharmacy employee or a courier. So if the employee cannot find the delivery location or the patient refuses the delivery, the medication can then be returned to stock if certain conditions are met. So specifically, here's 3 conditions. So the medication never left the control of the pharmacy, or the employee who attempted the delivery had the package in their possession the whole time. Secondly, the contents of the prescription order remained in its original sealed packaging. And thirdly, the contents of the prescription has been returned to the pharmacy on that same day that the unsuccessful delivery attempt happened. Patients are not the only consumers who may receive a drug delivery. So for example, a hospital with a large-scale compounding capability may contract with a smaller hospital to provide their patient-specific TPN solutions. In this case, a courier service will likely be used to transfer the TPNs from one facility to the other. Courier services are similar to shipping companies, but they only make local deliveries. All right, so delivering controlled substances to patients. The United States Postal Service regulations permit pharmacies to deliver controlled substances to patients if they are registered or exempt with the DEA. Most private shipping companies also permit the same, though they may have additional requirements such as signature upon delivery. The following preparation and packaging standards must be met to ship a controlled substance. So here's 3 conditions. The prescription label contains name and address of the pharmacy or the prescriber. The inner container is marked and sealed as required by law and is placed in an outer container. The outside wrapper or container is free of markings that could indicate what's inside. Here's another heading called kiosks. So another option for dispensing prescriptions is through a pharmacy kiosk. A kiosk is an automated dispensing cabinet that can be placed in various locations. It may be particularly beneficial in areas without a nearby pharmacy or in situations where medication is needed after hours. Some of these devices allow a patient to insert a written prescription into the machine, have it verified by a pharmacist, and then leave with their medication, while others are capable of refills via e-transfer only. A kiosk can be maintained by a licensed pharmacy. The pharmacy is responsible for following all of the laws related to its use, which can vary from state to state, but may be included in the state's telepharmacy or remote dispensing site requirements. Moving on to page 48. How about those old school vacuum tubes, like we see them in some of the banks still? Well, they were also in some of the CVS's and Walgreens back in the day. So vacuum tubes are used for drug delivery in different environments. Also, sometimes they're used in many hospitals. The tube delivery systems will vary in the shape and the size of the tube and in the transport force and speed. In any setting, limitations on the use of vacuum tubes for this purpose can be due to hazards created by the drug itself or drug decomposition that can occur during the delivery process. Drugs that are not safe to deliver by tube at any time would include hazardous compounds, and this includes chemotherapy, any product that is combustible, including gels or sprays, protein products which can become damaged from being agitated. Think about immunoglobulins and insulin. Each facility will need to develop guidelines in its policies and procedures manual that will include a list of drugs that should not be delivered by this method. If a specific drug is not mentioned and there is a lack of guidance on whether the drug can be delivered safely by this method, it will be left to the pharmacist's judgment to decide whether tube delivery is acceptable. If there is any doubt about a particular drug, tube delivery should not be used. Then we have our drive-up windows, right? So in a lot of our CVS's and Walgreens, lane 1, so they have the pharmacy drive-up window, drive-throughs. They're convenient for patients that need to pick up medications, but there are disadvantages. Limitations include difficulty providing confidential counseling, right? So privacy, the inability to open a container to discuss what's inside, and the inability to demonstrate the use of the non-oral medications like an inhaler. The window imposes a barrier to the pharmacist's ability to assess the patient for red flags of drug diversion as well. A few state boards have issued limitations on the use of the drive-up window. So for example, in the state of Delaware, they permit Schedule II prescriptions to be dropped off at the drive-up window, but they require a filled prescription to be picked up inside the store. We're moving on to page 49, public health reporting requirements. Some states mandate that certain activities or diseases be reported to the Board of Pharmacy, the local Department of Health, or both. Reportable items may include but are not limited to potential terrorist events, suspected physical abuse, tuberculosis infection or treatment. The pharmacy terrorist attack response plan may incorporate strategies for evacuation, temporary relocation, and emergency dispensing. All should be outlined in the pharmacy's policies and procedures (P&P) manual. As healthcare professionals, pharmacists and pharmacy staff may also be required to report any suspected or confirmed cases of TB, tuberculosis, or non-adherence to a tuberculosis TB regimen to the local public health department or to other authorities. Individual states may specify a time frame in which this information has to be reported. All states have laws regarding the mandatory reporting to social services of suspected physical abuse. This most often encompasses child abuse and neglect, but it can also include elder abuse. Pharmacists are mandatory reporters in most states and can voluntarily report in any jurisdiction. That concludes chapter 3, which we're in the UWorld RX Prep 8th edition Federal Law MPJE Review Manual. All right, thank you for listening.